Okay, so the injury I've chosen is wrist sprain slash tendonitis, but mostly wrist sprain because I personally have gotten a wrist sprain back in 2016, and I still have problems with my wrist, like really bad problems. I even have like a bump in my wrist now, right here. And I don't know why, because I never got it rechecked. And after I sprained it, I hyperextended it really badly. A 6'2" girl during a basketball game fell on my wrist and landed on it. So after that happened, it was terrible, and I got bruised. All of my extensors were bruised after that. I had to be in a sling. But now I have this bump, and I don't know why. But anyways, so the 3 bony landmarks that may get injured during a wrist sprain is the scaphoid, which is right over here. You can actually touch it. The lunate, which is right next to it on the ulnar side. And the radius, because it's mainly the thumb side that gets injured during hyperextension. So when this gets hyperextended, the radius also can get injured. 3 soft tissue injuries that can occur from this injury are obviously the wrist joint, or the radiocarpal joint, is where the carpals and the radius and ulna meet. The thenar eminence, which is the muscle at the base of the thumb. And I personally have issues with this muscle, so I know for a fact this gets injured during a hyperextension of the wrist because I still have pain here, and this happened in 2016. I still have pain here. I constantly have to like stretch my thumb, and I have to stretch and like crack my knuckles for like pressure to be relieved. And the third soft tissue that gets injured in this is the extensor tendons of the wrist. And the extensor tendons of the wrist come up to about right over here, and then they go into the extensor muscles. So the extensor muscles are coming down from here and then turn into the extensor tendons. So these tendons are the main ones that get injured during a wrist hyperextension. 2 examples of an acute treatment. Well, since I personally have this injury, they gave me a wrist brace. So my thumb goes in through there. Wrap it pretty tightly. Just like that, to immobilize the wrist. So this can be an acute treatment. I still use it, and it's been 4 years, so I still use it from time to time when I literally I lose grip sometimes, and and there's so much pain on the top of my hand that I have to use this. Or at work sometimes, I'm constantly going like this or like this, and that takes a toll also. So does writing. So sometimes I just need this to just like relieve pressure from my wrist. So this brace can be an acute treatment option. As you can see, this is very old. Or the old ice. The good old ice. To relieve swelling. Swelling is like the main thing that happens when you sprain your wrist. So in order to swelling to reduce, ice does help a lot. And I would put my hand in like ice baths for 20 minutes, and that kind of sucked, but it would definitely help after exercise. 2 examples of long-term treatment would be physical therapy, and we can do like banded exercises to strengthen these muscles this way, or stretch out the extensor muscles, stretch them very well. So you can do banded PT, or I don't have anything here that resembles this, but steroid injections. And I have gotten a few cortisone injections to relieve pain from my hand. So steroid injections can definitely, it can be a little bit of like acute treatment because the steroid injections do not last long at all. But definitely if you don't take care of the injury like I didn't, steroid injections can help for a significant amount of time. So that was the wrist sprain injury. And now on to the other joints, so the shoulder and the elbow joint. So the shoulder joint, the 3 bony landmarks I've chosen is the greater tubercle of the humerus, the clavicle, and then the greater tubercle of the humerus, and then the spine of the scapula. So you can feel that it comes to right here. And the 3 bony landmarks of the elbow. So the olecranon right over here, and then when you're in anatomical position, this would be medial. So this is the medial epicondyle right over here, and this is the lateral epicondyle. And that was my upper extremity video. Thank you.